Hi, my name is McKenna Osborne, and today for my nursing honors project, we are going to talk about Mary Breckinridge. First, let's discuss her early life. Mary Breckinridge was born on February 17, 1881 in Memphis, Tennessee. Her family was very rich and had a lot of political influence, so she moved around a lot. She lived in Mississippi, Kentucky, New York, Washington, D.C., Russia, and Europe. Her father's name was Clifton Rhodes Breckinridge, and he was a cotton planter and the U.S. representative from Arkansas. He was also a minister to Russia in 1894. Her grandfather's name was John Cabell Breckinridge, and he was President Buchanan's vice president. He was also the Secretary of War for President Davis in 1865 and a highly respected general in the Civil War. Next, let's discuss her education. As I stated before, Mary Breckinridge's family was very rich, so her early education was mostly from some of the most elite private tutors. She also attended boarding schools from 1896 to 1899, the first being Rosemont de Lazy School in Lausanne, Switzerland, and the second being Low and Haywood School in Stamford, Connecticut. From 1907 to 1910, she decided to further her education at St. Luke's Hospital School of Nursing in New York City, and in 1922 to 1923, she continued her education in New York City at the Teachers College of Columbia University. From 1923 to 1924, she moved to London, England, and furthered her education at the British Hospitals for Mothers and Babies in Woolwich and the York Road General Lying Hospital. Next, let's talk about her family life. Mary Breckinridge married her first husband, Henry Morrison, in 1904. He was a lawyer and unfortunately passed away in 1906 from appendicitis. She married her second husband, Richard Thomas, in 1912, and he was the president of a college. Unfortunately, they were divorced in 1920. With Richard, Mary had a son, Clifford, and a daughter, Polly. Clifford was born in 1914 and passed away in 1918, and Polly was born in 1916, but she only lived a few hours. Next, let's discuss Mary Breckinridge's career. This is a very broad career overview on a timeline. In 1906, she made the decision to become a nurse after her first husband, Henry, died of appendicitis. In 1912, she taught French and hygiene at the Crescent College and Conservatory for Young Women. In 1918, she volunteered to be a nurse in World War I and became a public health nurse in Washington, D.C. during the influenza pandemic. In 1921, she went to France on American Committee for Devastated France. And in 1928, she established the Frontier Nurse Service and became director of the Kentucky Committee for Mothers and Babies. Because that was such a brief overview, let's go ahead and break it down. In 1906, Mary's first husband, Henry, died from appendicitis. This tragedy led her to dedicate her life to medicine and become a nurse. From there, she attended St. Luke's Hospital of Schooling for 3 years. In 1912, Mary remarried to the president of Crescent College and Conservatory for Young Women and began to teach French and hygiene there. In 1914, she retired from teaching and had her son Clifford, and in 1916 had her daughter Polly, who lived only a few hours. After Clifford's death in 1918, Mary left her husband to be a volunteer nurse in World War I. That same year, Mary traveled to Washington, D.C. during the influenza pandemic to become a public health nurse. There, she gained charge of 1/5 of the city's medical area and led 5 other nurses and their trainees. After that, she went to France for 3 years on the American Committee for Devastated France, where she organized disaster relief for pregnant women and children, as well as a child hygiene and a visiting nurse association. For her work in France, she was awarded the following medal. In 1922, Mary returned to New York City to complete 1 year of postgraduate classes at the Teachers College of Columbia University. The following year, in 1923, she then moved to Woolwich, London, England, to attend the British Hospitals for Mothers and Babies to become a qualified midwife. She made this decision after she saw most of the midwives in rural areas back in the United States were illiterate and inadequately trained. She was awarded the midwife certificate in 1924. That same year, Mary completed more postgraduate classes at York Road General Lying Hospital for 1 year in London. She did this with the intent to learn more about rural nursing so that she could establish the first midwifery in Kentucky. In 1925, she returned to the United States and established the Kentucky Committee for Mothers and Babies in Leslie County, Kentucky. 3 years later, in 1928, her committee became the Frontier Nurse Service, and she went on to serve as the director there for 37 years. So why did Mary Breckinridge decide to bring her influence to Kentucky? Kentucky was known for having the highest birth rate, yet also the highest rate of maternal mortality. For every 100,000 births, there were about 800 maternal deaths, and about 10,000 out of every 100,000 infants died before they turned the age of 1. Kentucky proved to be an area of difficulty with plenty of mountain ranges and virtually no doctors. Mary very quickly realized that most of the midwives in Kentucky were simply women who decided to step in and help, many with little to no education and some even being illiterate. Mary used her popularity to raise over $6 million to establish her Kentucky Committee of Mothers and Babies in 1925. Just 5 years later, by 1930, she had expanded to 9 district locations and 6 satellite locations. Most of the midwives would travel to homes on horseback and would stay up to 2 days after the birth. In 1939, she established the Frontier Graduate School of Midwifery, which is now known as the Frontier Nursing University. Because of Mary Breckinridge, the previous mortality statistics declined to only 11 deaths out of 14,500 births and have continued to decline ever since then. Mary had a vision to serve a poor, unreached rural area and not only change the people's lives, but improve the possibility of a future, and that is exactly what she did. Lastly, let's discuss her death and legacy. Mary Breckinridge died on May 16, 1965 in Hyden, Kentucky. She is deemed as the founder of one of the most comprehensive healthcare systems in the United States. She is also known for influence on nursing as a whole, leaving a standing mark due to her dedication and commitment to lifelong education in order to better understand and treat her patients. Students all over the United States, whether in history or nursing classes, still learn about her and her impact on the world. As for the Kentucky Committee for Mothers and Babies, the organization is now called the Frontier Nursing Service and has 6 healthcare clinics, one being in the Mary Breckinridge Hospital. Frontier Nursing University's current goal is as follows: to enable nurses to remain in their communities while obtaining graduate education as nurse midwives and ultimately increase the number of practicing nurse midwives working in underserved areas. The following slide will show the sources that I got this information from, shown here. Thank you for your time, and I hope you enjoyed listening to my presentation.